Medicare Open Enrollment is here, and this year brings big changes that could impact your health coverage. From lower prescription drug costs to new caps on out-of-pocket expenses, there are some positive shifts, but watch out for higher deductibles and potential cuts to coverage. With so much on the line, understanding these updates is crucial. Coming up, our expert panel will explain what changes are in place and answer your questions. Prescription for Change, exploring Medicare's benefits and lower drug prices town hall. Next.
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.
Good evening, everyone, and welcome to Prescription for Change, exploring Medicare's new benefits and lower drug costs. I'm Olga Villaverde. So today, more than 66 million Americans rely on Medicare, and keeping up with the changes and choosing the right plan, it's essential. That's why tonight we are here to help all of you. Over the next 30 minutes, we're going to be highlighting some major changes in Medicare coverage for 2025. We'll also tell you about some exciting news that will save you money on common drugs in the coming years. So let's introduce to you our panel of experts today. First, we have Dr. Meena Seshamani. Dr. Seshamani is the CMS Deputy Administrator and is also the Director of the Center for Medicare. We're also joined by Andrea Davis. Andrea is the Vice President of Product Growth and Operations for Florida Blue Medicare. And we also have Dr. Joel Caschette. He's the Chief Medical Officer for UnitedHealthcare of Florida Medicare and Retirement Plans. Thank you all for joining us tonight. So appreciate your time.
Thank you for having us.
Thank you for having me.
So for 2025, Medicare will undergo some of the most significant changes in a generation. Dr. Seshamani, let me start with you. Let's talk about these changes. And were they the result in changes in federal regulations?
Yeah, I mean, this is, as you said, a very exciting time in Medicare. These are some of the biggest changes to occur in prescription drug coverage since Medicare prescription drug coverage started in 2003. Big changes for everyone to be aware of for this year's open enrollment, which is happening right now. First, starting January 1st, 2025, for the first time ever in the history of the there will be a cap on how much people with Medicare spend out of their own pocket on prescription drugs, a cap of in the calendar year. This brings really needed financial relief to millions of people. The second is that starting January 1st, 2025, people will have an opportunity to spread their prescription drug costs out the calendar year. So if they go to the pharmacy and have, a large copay, they don't have to pay it all up front. They can instead spread it out over the year through the Medicare prescription payment plan. And the third big change is that we have expanded eligibility for our financial assistance program called Extra Help. So if you make less than $23,000 a year or less than $31,000 as a married couple, you could be eligible for this financial assistance that would significantly decrease your prescription drug cost. Say $4.50 for a generic drug or $11 for a brand drug. And I think it's so this conversation because during open enrollment, make sure that you are enrolled in the option that works best for your health and financial needs. That $2,000 out-of-pocket cap that I mentioned only applies for prescription drugs that are covered by your prescription drug plan. So it is so important to make sure that the drugs that you take are covered by the plan that you want to enroll in. And this is also the time to talk to your prescription drug you could benefit from spreading out your costs through the prescription payment plan, for example.
Great information there. Thank you so much, Doctor. And Andrea, let me turn to you. So what is this? What do all these changes actually mean to recipients? It's a big deal.
So as Dr. Seshamani said, a lot of changes for 2025. So some great news, as she mentioned, beneficiaries for their prescription drug plans are going to see their maximum out-of-pocket decrease substantially this year. That's a savings of up to $6,000 for Medicare beneficiaries, which is great.
Wow, that's a big difference there.
$8,000 cap to $2,000, which is fantastic. In addition to that, the spreading out of the copays over the year, such a great change for those who need to participate in the prescription Medicare prescription program. We're looking forward to supporting that. On the flip side, I will say, as we are about 15 days into annual enrollment right now, we are seeing that those changes have put some pressures on other parts of Medicare. So as an example, some copays, maximum out-of-pocket cost for plans have changed this year, kind of unlike what we've seen in prior years. So important for beneficiaries this year to read their annual notice of change that was delivered at the beginning of October, and to really reflect on the things that are most important to them coming up in 2025.
Great stuff. All right, so Dr. Caschette, let me bring you in. Some Medicare recipients have actually told me that due to these changes, they're concerned about losing coverage, like, for example, their dental coverage. What would you tell them?
It's really something worth considering. It's important to remember that Medicare Advantage plans can change every year. So it's a good idea, as has been mentioned, to review your current coverage to see if anything has changed, either with your current plan, your health status, and it's also important to consider your budget. Right now, as we've mentioned, we're in the Medicare annual enrollment period from October 15th through December 7th. So here's the chance for people to make changes or confirm their coverage for the next year. Keep in mind, there's no one-size-fits-all approach when you're shopping for Medicare coverage. So if dental coverage is important to you, you want to make sure that that's what's included in your plan. And if you've had a plan with dental coverage, you want to make sure that the coverage that makes sense for you is still in that plan.
All right, thank you so much, Doctor. Now let's check out this message from Medicare about plan options. Take a look.
An official message from Medicare.
I usually love plot twists, but this year I'm comparing my options during Medicare Open Enrollment.
You don't want any surprises. You can't assume your current health or drug plan is the best one for you.
And make sure your prescriptions are covered. That's important.
And save some money.
Paperbacks and saving bucks? I like that.
Review your coverage and compare your health options at Medicare.gov. Open enrollment ends December 7th. Paid for by the U.S. Department of Health and Human Services.
So that video is a great way to segue to our next segment. We know that in order for Medicare recipients to pick the right plan, it's important to understand what each plan covers. So let's take a look at what we call the ABCs of Medicare.
When you're first getting started with Medicare, there can be a lot to learn and consider. And it might seem overwhelming. Let's start at the beginning with the ABCs and D of Medicare. Medicare includes parts that are the building blocks of your health and drug coverage. Part A, Part B, and Part D. And there's also Medicare Advantage, sometimes known as Medicare Part C. Let's start with Medicare Part A. Medicare Part A is sometimes called hospital insurance. It covers hospital care, like inpatient care at a hospital, skilled nursing facility care, hospice care, and some home health care. Usually, you don't need to pay a monthly premium for Part A. Medicare Part B, or medical insurance, covers services like certain doctor visits, outpatient care, medical equipment like wheelchairs, and preventive services like flu shots. With Part B, you'll pay a premium every month. In many cases, if you don't sign up when you're first eligible, you'll have to pay a late enrollment penalty, which is added to the monthly premium cost for as long as you have Part B. That can add up, so it's important to pay attention to your deadlines. Medicare Part A and Part B are both under what's called Original Medicare. If you want drug coverage too, then you can join a separate Medicare Part D plan. Medicare Part D coverage is provided by private companies that you can choose from. For a Medicare Part D plan, you'll pay a monthly premium that depends on the plan. Remember to consider your plan options when you're first eligible to avoid late enrollment penalties. And finally, there's Medicare Advantage, also known as Medicare Part C. Medicare Advantage plans are another way to get your Medicare Part A and Part B coverage. These are Medicare-approved plans offered by private companies that bundle your Part A and Part B coverage, and usually include Part D drug coverage too. Most plans include extra benefits like vision, hearing, dental, and more. Ready to learn more? Visit Medicare.gov or review the Medicare and You Handbook. You can also watch the other Get Started with Medicare videos at Medicare.gov. This product was produced at U.S. taxpayer expense.
So that video explained what the different plans are, but now the hard part begins, shopping for the plan that's best for you. So Dr. Seshamani, tell us why open enrollment is so important to people with Medicare.
Well, open enrollment is the time of the year where everybody with Medicare coverage can make sure that the option that they have works best for their health and financial needs. People's health needs change every year, and their financial needs can change every year. And as we have been talking about some very exciting improvements to the Medicare program this year that it's important for people to take advantage of. And now is the time. December 7th, if you miss the deadline, then you would have to wait likely until the next open enrollment a year from now to be able to find a plan that works best for you. So just think, we were talking about that historic $2,000 out-of-pocket cap. If you don't go and make sure that your prescription drug plan covers your prescription drugs, you could miss out on that huge savings from that $2,000 out-of-pocket cap. So it is so important that people use this time to be able to pick the option that works best for them.
Absolutely. Thank you so much, Doctor. December 7th, that is the date. Andrea, can you give our viewers some key points of each of the different plans, including actually the privately run Medicare Advantage plans?
Absolutely.
I mean, it can get confusing.
It gets very confusing. I actually laugh a little bit each time I hear the ABCs of Medicare, because I explain that to my mom, my dad, and my in-laws every AEP, because they come and say, which one is right for me? And as we have reinforced so far, the answer is different for everyone. It depends on your specific needs. It depends on the doctors that are important to you. It depends on your budget and your prescription drug needs, just to name a few. So to try to simplify it a little bit, the education at this time of year is so important. And to me, it starts with a choice of original Medicare versus Medicare Advantage. Original Medicare, as we saw in the video, named Parts A and B, can oftentimes be supplemented by a Medicare supplement policy. So adding another option in there. So if you want to stay on original Medicare, your Parts A and B, you will want to look at prescription drug, Part D, and then there's the option to buy supplemental insurance through a Medicare supplement, or sometimes called a Medigap plan. That choice does come with some budget expectations, so be prepared for a little bit of sticker shock sometimes on that choice. But there is no network for your doctors or hospitals. So anyone who accepts Medicare, whether that's a primary care physician, a hospital, or a specialist, those will be available to you. No network restrictions on those types of plans. And then there's Medicare Advantage. So as the video talked about, Medicare Advantage, also known as Part C, bundles your A, B, and most times D, which is your prescription drug. And many of the Medicare Advantage plans are available for no additional premium. So again, just really depending on your specific needs, take this time of year to get educated on what those choices are.
And that's why town halls like this are so important. Dr. Caschette, some Medicare Advantage plans talk about having no premiums. Now that may sound intriguing, but price is only one variable to consider. Budget, right? What are some other important things for consumers to keep in mind, would you say?
Yeah, it is interesting when we see $0 premiums, but as you mentioned, it's important to pay attention to more than just the premiums. There's other costs involved. We have to remember deductibles and co-pays that we can also see in these plans. These costs can add up, so it's important to consider those when you're choosing a Medicare plan. One thing I'd also mention is that Medicare Advantage plans are becoming increasingly popular given some of the cost protections that they provide. The value in Medicare Advantage is strong with broad access to, for example, low and $0 premiums, $0 preventative care, and then there's all-in-one coverage for prescription drugs, and there's also some valued extras there. For example, gym memberships, health and wellness tools, dental coverage, virtual visits, and more. So there's a lot of choices out there. I think it's important for people to go ahead and look to see what really works best for their specific health situation and their budget.
Dr. Caschette, before we move on, I do have a viewer question, and I'm going to give it to you if you don't mind. This viewer asks, what's the difference between in-network and out-of-network? That's a great question that a lot of people don't understand.
Yep. In-network and out-of-network, especially with an HMO versus a PPO, we hear those terms. With an HMO, people are expected to use in-network physicians in order to get the benefit from their plans. There's out-of-network physicians as well. And when you have a PPO, you can pay an out-of-network deductible. And for the in-network folks, in-network physicians, you'll pay an in-network deductible, which is lower. In general, though, HMOs only cover the in-network provider. So if you're trying to use an out-of-network provider, you may end up bearing the cost of that. It's important to keep in mind when you're looking at HMOs versus PPOs.
All right, thank you so much. Dr. Seshamani, I got another viewer question that was just sent in. This viewer says, I just turned 65 and I'm excited to go on Medicare. I'm unsure if I should be on Medicare Advantage plan and what that really is. How would you describe the differences in plans to her?
Yeah, well, as has been mentioned, there are ways that you can get your Medicare coverage through original or traditional Medicare or through Medicare Advantage. With you can see any healthcare provider in the country that participates in the Medicare program, about 98% of healthcare providers in the country. With Medicare Advantage, as has been mentioned, you have to see a healthcare provider that is in the network of that plan. So you have a more limited, set of options in terms of who you can see, and it's important to check to make sure that your the provider that you like to see is in the network. On the Medicare Advantage side, there also can be additional authorizations that are needed in order to obtain care. You sometimes have to get approval from the health plan. And as has been mentioned, on Medicare Advantage, you can have some additional benefits, such as additional dental benefits or vision or hearing. So that's why it's so important for you about your different options to see the doctors. You're able to see them, what are the benefits that are being provided and what is important to you.
Fantastic. Andrea, I have another question here. I love this question. What happens if someone eligible for Medicare misses the deadline to enroll? Are they out of luck? Good question there.
It's a great question. So AEP, our annual enrollment period for Medicare, does end on December 7th. Every year, October 15th through December 7th is when you have that election. There is an open enrollment period, however, OEP, that does run from January through the end of March. And so some beneficiaries do have the option to make one additional change during that OEP period.
Fantastic. More questions coming in. Dr. Caschette, I'm going to give this one to you. This viewer writes,
Okay.
I want to sign up for Medicare Advantage because of the great benefits, but my doctor only accepts regular Medicare. Do I have to change doctors?
Yeah, that can be an interesting situation. In situations like that, I think it's important to look to see what benefits are there. Again, if there is a very distinct network and you're dealing with an HMO, then that doctor may not be in network. So that might not be the right plan for that individual. But one thing that could be considered is, say, a PPO plan where you can still use that physician as an out-of-network provider. But usually the best thing to do is think about the doctors that you want to see and try to make sure that those doctors are in network, because that'll make more financial sense and you'll also be able to maintain that relationship.
Thank you, Doctor. More questions coming in. We've got about 5 minutes left. Andrea, I'm going to give this one to you. Are there plans that include home health care? I'd like to get a home health aide for my disabled father, but his current plan doesn't cover that. What would you say?
There are some plans who do cover that benefit. So definitely part of the research leading up to AEP. When you have priorities such as home health care, it's not offered on all plans, but definitely on some.
All right, Dr. Seshamani, another question that just came in. Can you talk about how people can compare their Medicare options and tell us where they should go to find out more?
Yes, this is so important. There are three main ways that you can compare your Medicare options. First, go to Medicare.gov. You click on Find Plans Now. You can input your own prescription drugs and pharmacy, and you can get a side-by-side comparison of plans comparing on cost, coverage, and quality to be able to make a choice. But sometimes people want to talk to someone. So way number two, call us at 1-800-MEDICARE. We are available 24 hours a day, 7 days a week to help you navigate your options. And the third way, sometimes people want to meet someone in person and have more local support. So you can find a local counselor through the state health insurance or SHIP. You can go to shiphelp.org near you. So again, three main ways: Medicare.gov, 1-800-MEDICARE, and shiphelp.org. These are the three official, unbiased sources of information that will on all of your Medicare options. As you know, there are and phone calls that sales agents make. Those are for more specific plans. If you want to get all of your options, it's Medicare.gov, 1-800-MEDICARE, and shiphelp.org.
Great. I want to get to this question, even though we only have a few minutes left. Andrea, when is the deadline to enroll? I know we said it, but I think it's always important to repeat. And who can participate in Medicare Open Enrollment?
Very important to repeat, December 7th. So mark your calendars. Make sure that you are doing your research leading up to that day, and you are working either on Medicare.gov, through a local agent, however it is that you wish to shop, so that you are getting your application for 2025 coverage in by December 7th. And anyone who is Medicare eligible participates in annual enrollment period. So if you currently have a Medicare Advantage plan, Original Medicare, or you are aging in and within your window of your initial enrollment period for Medicare, make sure you are making that choice by December 7th.
Fantastic. All right, Dr. Caschette, I'm going to give you possibly our last one from our viewers. Thank you so much for your questions, everyone. They have repeatedly said PPO and HMO. Can someone tell us the difference? And I've got about 1 minute, sir.
HMO is a health maintenance organization. And again, those oftentimes will see a lower cost, a lower premium associated with HMO, where at the same time, a PPO allows for not just in-network with, let's say, potentially a more narrow network like the HMO has. You can see in-network providers and also out-of-network providers. Keep in mind that your copay with out-of-network providers is going to be higher than the in-network providers. PPOs sometimes involve a higher premium, but there is more flexibility as far as the providers that you see.
The bottom line is really everyone has to do a lot of homework, right, Andrea?
Absolutely.
They just can't assume, even though you've been happy year after year, you've got to make sure it's still what you want.
Absolutely, and I encourage everyone, as we've all mentioned, a lot of changes for 2025. So if in prior years you've just set it and forget it, because next year it's all going to be the same, let's not do that this year. Make sure you look at your annual notice of change and get your research done for December 7th.
And I believe the number is 1-800-MEDICARE, correct? 1-800-MEDICARE. Thank you so much to everyone. I want to thank you all for your time, Andrea, Dr. Caschette, and Dr. Seshamani. Thank you for your insight. And of course, remember that the 2025 Medicare Open Enrollment period runs from now through December 7th. We've said it over and over, but remember December 7th. So make sure to sign up before the deadline. The most important thing is to make sure you make an informed decision to allow Medicare to work best for you. Thank you for joining us this evening. I'm Olga Villaverde, and as always, we'll see you next time. You take care.
Thank you to the Eunice Joyce Gardner Charitable Foundation for its leadership support of the Health Channel.